Hi everyone, I'm Craig Clifford. I'm a medical oncologist and I practice in Malvern, Pennsylvania. And we're going to spend a little bit of time talking about what's new in oncology, talking about two new products, Teglnoltiglate and Vernexer.
This show is brought to you by Brave Paws Anxiety and Stress Support Chewables for Dogs. Thunderstorms, vet visits, fireworks, separation anxiety, and more. Every day can be a Brave Paws day. Check out mybravepaws.com.
We love our fur babies so much, but when they're stressed out, it makes us stressed out. Some dogs hate loud noises like thunderstorms and fireworks, and sometimes they just don't want to be left home alone. To help keep them calm in moments of stress, use Brave Paws Anxiety and Stress Support Chewables for Dogs. These plant-based chewables promote calm behavior with natural ingredients that have been clinically studied. Did I mention they're fast-acting and non-drowsy? I especially love that Brave Paws helps farmers in Costa Rica by sourcing ingredients from a woman-led co-op that uses reusable energy and regenerative agriculture. How cool is that? Learn more at mybravepaws.com.
My veterinary training was at Mississippi State University. My internship and residency were at the University of Pennsylvania in medical oncology. After that, I've been in private practice, where I'm currently one of 4 medical oncologists in Malvern, Pennsylvania. So being an oncologist, this is really an exciting time in that we're starting to see a fair number of new products entering the oncology market, and we're excited about the use of them. So what we're going to do is talk about 2 of these today and where we think they probably have their own niches. So the first product we want to talk about is a very novel and interesting product for canine mast cell tumors. Certainly you've seen about it in the trade magazines and in the various journal articles that have come out regarding it. It's called Teglnoltiglate, and this is a very interesting product. It comes from a seed from a bush in Australia called Fontanella picosperma. And it's it's involved in intratumoral injection, and when it's in there, it affects the signaling cascade within the cells that may actually push cells to die. It also has something called ischemic necrosis with it. So it actually destroys the blood supply to the tumor and also brings in the immune system with it. It does have full FDA approval in the United States, so this is out there, and it is not restricted to oncologists. And then there are other European countries and other countries where they are seeking to have this out. One of the first studies which came out in Frontiers in Veterinary Science in 2019 by Miller et al. Was looking at different dosaging of TT. So Teglnoltiglate we're going to call TT just because it's a tongue twister. And what they evaluated was low doses, moderate doses, and a higher dose. And what this helped them to be able to do is to determine what was going to be the actual dose to move forward. And what they did find was that the dose, which is now what we use on the label, 1 mg per mil, the highest dose concentration that was given, they had a very, very high 90% of the patients that were injected with this had a complete response when it was assessed. The adverse event profile was related to what the compound does locally, the swelling, opening up of the lesion, etc. But most of the side effects were very mild and self-limiting, and there were very few, if any, blood work abnormalities that were noted. So looking at the images, you can see the first one is our tumor prior to treatment. Then we look at what's called the oncolytic and inflammatory effect that occurs after it's been injected, and that's usually day 1 to 3. The first thing that happens is an ischemic necrosis, where essentially the blood vessels are destroyed in a sense, so the tumor is not getting its blood supply. At the same point, it's pushing forward the signaling pathway, protein kinase C, which pushes the cancer cells to die. The third aspect that happens is increased permeability within the blood vessels that are there, and immune system cells start to invade in. And the other things the immune system cells start to do, neutrophils, etc., they release their contents. And basically this burst of theirs of releasing cytokines and other enzymes cause further destruction of the tumor cells. Then over time, what we start to see happen is the top of the tumor starts to become necrotic, and we can actually start to see it becoming smaller, and you can almost see an open wound off to the side. And what's very fascinating, and this goes against the entire paradigm of what we've been trained in veterinary medicine, what they recommend is you don't have to put the e-collar on the dog can lick off the dead tissue. I know we always say you should never have an open wound, but you do have it in this case. And what is interesting about the product is it also stimulates healing of the underlying tissue. So what you start to see in the next couple of images is we have an opening and then it slowly starts to close. And the vast majority of cases are completely healed by day 28. So that is amazing that not only does it destroy the tumor, but then it allows the healing to occur that you can barely visualize where the mass was present. So in regards to the indications for TT, it is approved by the FDA and it's for all grades of non-metastatic mast cell, all cutaneous mast cells, and if it's a sub-Q, it has to be located distal to the elbow or distal to the hock. And that has to do with allowing it to be able to drain. The tumors have to be less than or equal to 10 cubic centimeters in volume, and that's something we're not used to measuring. Usually we just measure the longest dimension, but they have to be a certain size in order to be able to be utilized, and it has to be something that we can inject the product into it. So determining the tumor volume, this is going to be evaluating a modified ellipsoid technique. Basically, we're looking at cubic centimeters, and we do this by looking at half of the length of the tumor in centimeters times the width in centimeters times the depth in centimeters. The dogs are then treated at 0.5 ml per cubic centimeter at day 0, meaning the day that we start treatment. The formulation of the product, it's 1 mg per mil, and it's a minimum dose of 0.1 milligram and a maximum dose of 5 milligram. The other way we can look at the maximum dose is 0.25 mLs per kilogram of body weight. So when we're utilizing this product though, it's administered through the needle, but it's through one access point. So basically you're going to take your needle and then fan the injection through multiple areas within the tumor. So keep that in mind. It's not going to be pulling the needle back out. So it needs to be one that we can get our hands on, that we can hold it to be able to place the needle into it. And then we also want to make sure it's not an ulcerated tumor, because if we inject an ulcerated tumor, some of the material may actually leak back out onto the skin. You're going to want to wear gloves with this because of the fact that we want to make sure there isn't any inadvertent exposure. When we're going to utilize this product, generally we're going to be using concomitant medications with prednisone, famotidine, and diphenhydramine. And this is used for several days at the time of the injection and several days after. And the rationale for it, again, is that we're destroying the tumor. So there's probably going to be a great deal of histamine released, and we're trying to prevent any adverse events as a result of a massive histamine release. So based upon the one study that was part of the pivotal trial for this product with TT, of 80 dogs that received the product, at day 28, 60 of them, so 75%, had a complete response. Another 5% of dogs had a partial response. They then took the dogs that either had stable disease, which was 12%, or progressive disease, and then allowed them to receive a second injection if they did not have a complete response. And with that, it brought the overall complete response rate up to over 70%. If we then look at the untreated controls, so all they received essentially was a sham, the vast majority of these cases just stayed stable. Only a very small percentage actually still had a complete response. So there was clearly a statistical difference in regards to complete response rate at day 28 for TT versus the untreated control. So as part of the trial, the other thing that was done was dogs at day 28 that had not gotten a complete response after one injection of TT were allowed to get a second injection. And with that, the complete response rate went from 75% to 88%. So the tail of this tells us that if you treat a patient, you don't have a complete response at day 28, you can give a second injection of the product in order to have a higher chance of obtaining a complete response. The study also assessed at the end of the trial, which was day 84, how many of these patients were still considered disease-free, meaning those that had a complete response, how many were still gone. And in general, of the 75% that had a complete response, 96% of those were still disease-free at day 84. So that's an important point to keep in mind. In regards to the healing that's promoted by the product, Roughly 60% of the patients at day 28, the area had healed, close to 80% by day 42, and 96% by day 84, the lesion had completely healed over. What was also quite interesting, as I had mentioned, was the vast majority of patients were not put on antibiotics, and very few patients had to be bandaged, and very few patients, if any, needed an e-collar. So this is very, very different than what we're used to. We're all taught in veterinary medicine, you can't have an open wound. You need to be on antibiotics, you need to bandage it, or we need to close it right away. That's not the case with this product. So this is definitely a paradigm shifter in regards to wound management. In regards to the adverse events, the vast majority were mild and self-limiting, and most of them were related to how the product works, meaning swelling at the site, maybe some pain at the site, an open wound. Well, of course, that's what the product does. So that's nothing that I am concerned about when I look at something like this. It's what's expected. When we look at after a single injection how these patients lasted, the study was up to day 84, but they did follow the patients longer. So in looking at a 12-month time period, the vast majority of patients, probably close to 90%, were still tumor-free at their site. So that's certainly something that's quite important to keep in mind with this product. So the question myself and many oncologists have been getting is, where does this product fit in? Do we think it's going to replace surgery? I don't foresee that happening, but I think we're going to find a niche for it. For me, some of the things that pop up would be a dog who's had multiple mast cell tumors. It looks like Frankenstein. It's been cut so many times and the owner finally decides, I don't want to do this again. This would be a very valuable product for that. Or a tumor's in a challenging location for surgery. You're worried that it may end up leading to compromising the patient's overall quality of life. That may be one. And then there's some also interesting rat data to suggest that there may be an abscopal effect. Basically, the definition of that is if we had a case with multiple lesions, we could treat one, it responds, but the others distant to that respond as well. We're waiting to see if this is true in dogs, so hold on to that, but certainly at least the mice models point to it. The challenges with the product, of course, are we need cytologic grading because if you have a complete response, there's no tumor to biopsy. You're not going to take a dead portion of tumor and submit it. So we need to know whether this is a low-grade tumor, and if so, then TT is all we need if it gives us a complete response because it's going to give us our local control. But if it's a high-grade tumor, then we need systemic therapy. So we're still getting there in understanding cytologic grading. But if this is a product that you're looking to do, I would certainly recommend reaching out to whatever lab you normally send cytology to and ask them whether this is a product that, do they look at cytologic grading? Can they provide you for it in order to utilize the product properly? Because my only fear is if we don't have this, we may have some cases that we undertreat. The final question that's been asked is, can it be used off-label? We don't have a ton of data for it for other cancers, but technically it could be used off-label. Based upon what the drug does, though, that's going to require a significant conversation with the owner, certainly one that recommends against maybe standard of care for whatever other cancer it might be utilized for. But this is an exciting compound with very interesting, unique aspects to it, and we're excited to have it in the veterinary market. The next product we want to talk about is a drug called Vernexer. This is an oral medication for dogs with lymphoma. This is not chemotherapy per se. It's a very different class of drug called a SINE inhibitor, which stands for Selective Inhibition of Nuclear Transport. So what does that mean? Well, if we think about the cell with the nucleus being the brain of the cell, within the nucleus are proteins called tumor suppressor proteins. And their job is if the DNA becomes damaged, it will tell the cell to either repair yourself to get back to normal, or it'll send it down a death pathway if it can't be fixed. And that's normally what our body does to cells. What we have found is that cancer cells can overexpress this nuclear export system. And basically what it does is it takes these tumor suppressor proteins and shuttles them outside the nucleus into the cytoplasm. Without them being there, now an abnormal cell can continue to be abnormal. These are very much present more so in cancer cells, so it appears that this is very specific to the cancer cells themselves. So it's quite fascinating mechanism of action. It's not like chemotherapy that kills everything growing. This is a very specific targeted mechanism. So Vernexer has been shown that it can induce apoptosis, which is natural cell death, in a variety of human and veterinary cancer cell lines, ranging from lymphoma to osteosarcoma to transitional cell carcinoma and melanoma, among others. The other real important thing about this drug is it does not appear to be a substrate for P glycoprotein, which means that using this drug by itself should not induce multi-drug resistance, like if we had started a patient on prednisone only and then we try to treat it, it's much harder to treat them. That should not be the case with this product. There have been several studies with Vernexer, but the one that led to its conditional approval was looking at 58 dogs, 35 of which were naive, 22 were relapsed dogs. And in regards to the product, it overall had about a 34 to 35% response rate. The response rate was relatively higher if they were naive, and the overall duration of the response was longer if they were naive versus relapse, which makes sense. We tend to see that with almost any drug that we utilized. When we look at the overall time frame that it tended to help the patients, it was probably for naive patients along the lines of about 35, 36 days. And overall, it was about 30 days looking at all of the dogs. So when we look at the patients that were treated, again, it was 58 dogs total. The overall response rate, whether it was a partial response or a complete response, was about 34%. But what was interesting was there is a number of patients that had what's called the clinical benefit, which means they may have just stayed stable on it or they only slowly progressed. And that added a fair bit of patients to the overall numbers, in that a good number of patients actually were able to just stay on the drug and their lymphoma stayed relatively stable. What's also interesting is we tend to say nothing works very well against T cell, but the responses or clinical benefit, which would be either a complete response, a partial response, or stable disease. If they were able to maintain that, that represented about 71% of the T cells, whether it was a naive T cell or a relapsed T cell. So that's certainly much higher response rates than we tend to see with other drugs. And what is quite interesting with this product was that generally when we do a clinical trial, we have very defined data as if the lymph node is bigger than X amount, it's considered progressive disease. Well, in this trial, if the patient had what's called the clinical benefit, meaning they may have been progressing, so the numbers showed that it had grown, the nodes, but they felt great on the drug, they were allowed to stay on it. And a fair number of patients were on it well beyond what the clinical trial time limit was, which was 56 days. 20 dogs were on it well over that, and a good number of them, even though they were deemed per the study progressed, they stayed on it for several months. So it's going to be very interesting as we learn about this drug to try to pick out who are going to be those patients that can sit there with their large cell lymphoma, which we know grows like this. So to be able to have a drug within a subset that may hold it stable for a period of time certainly is very interesting, and it's not something that we currently have available. In looking at the adverse event profile with this product, it's actually quite favorable. The most common adverse event, which was almost about 45% of the patients, was anorexia. So they did not eat as well. So now that we understand this, when we're going to be utilizing this product, more likely than not, we may reach for an appetite stimulant for these patients rather quickly. So the labeled dose is 1.25 milligrams per kilogram orally twice a week. So you're either looking at Monday, Thursday, or Tuesday, Friday. You want to have at least 72 hours in between. If dose reductions are needed, they certainly can be done. The positive with this is that this is an oral medication that is done by the owners at home. In regards to the monitoring, initially we may see them every 2 weeks just to assess them for body weight, etc. But there's really not a great deal of monitoring that's needed because there's not a ton of biochemical abnormalities that occur with this. A lot of it is, are they eating? What are the lymph nodes doing? So I think the vast majority of us, at least initially, will probably see them every 2 to 3 weeks as we get started to see how they're handling the product, and we can watch their weight and their appetite. So in regards to the product being that it's an oral medication, certainly we're going to want to be wearing gloves and make sure the owners are wearing gloves when they're administering it. It's going to come in 3 pill sizes. For small dogs, 2.5 milligrams, 10 milligram, and then a 50 milligram for the larger dogs. So by having multiple dosings, that certainly makes it easier in order to be able to provide an adequate dose for the selected patient. So the million-dollar question, since this is a new product that we're getting asked, is where is this going to fit in? So I think the bottom line is I don't think we know yet exactly where this is going to go. The data certainly is limited. It's not a massive number of cases, hence why it's conditionally approved. This is not a full approval to the product. They're currently in the process of getting their pivotal trial together, which will allow it to have full approval. The label itself is very broad, so that's very interesting in that it allows us to use it for any type of canine lymphoma. It could be cutaneous lymphoma, it could be mediastinal, hypercalcemic, it could be an indolent. Any of those are certainly possible. Where I foresee the product is going to be in a couple of avenues. Certainly, I think for the primary care who diagnose a lot of lymphomas and the owner says, I can't afford CHOP or I'm not going to go through with it, but I want to do more than just prednisone, this seems like a reasonable product. We know that the response duration is not going to be incredibly long, but it may provide the owner some extra time. Plus, if it works, the owner may then change their mind and decide to treat. And being on this drug is not going to make the response for chemotherapy drop because it does not induce multi-drug resistance like prednisone is. So I foresee this with the primary care in an owner that maybe can't get into an oncologist right away or they elect against treatment. In a relapse setting, a dog relapses after having been treated and the owner decides against an aggressive protocol. That's where I foresee this. Looking at T-cell lymphoma, although it was a small number of cases, the response rate was over 70%, which is much higher than we traditionally see. Cutaneous lymphoma is a very challenging disease to treat. Maybe this is something that we can look at. Others might be indolent lymphomas, which for the most part we don't treat, but in select cases where they progress, we may move to treatment. So this would be an interesting product for it. The maintenance setting after chemo, if we had a case that took a long time to get into remission, and they were only a partial response for a cycle or two and then finally had a complete response and we're worried they're going to relapse early, or they had a number of bad indicators and we're worried they're going to come out of remission early, maybe this can be used in the maintenance setting. Can it be combined with chemo? Per the label, it looks like it can be. It doesn't seem to be against the label to be giving it with other drugs. But I think we don't know the data for that yet. So that's where we're going to be learning a whole lot about it. Where can we place it? Where can we try it? So I think we're excited to have the product. This is not necessarily going to be a complete game changer, but I think it's going to have its niche. And I think that there are a number of areas where this product may fit in. And I'm excited that we have it, that we have the ability to determine where is this product going to be best utilized. So those are two of our most recent advancements in veterinary oncology that we are very excited about. We have two new products that are out there for two very different cancers. If you like what you've seen today, please hit the subscribe button for this channel. And if you'd like to hear more from me, you can follow me on LinkedIn or Instagram. Thank you so much, everyone.